This is the Pain Podcast, Le Pub Scientifique, and my name is Bart van Bugem. I'm a pain specialist physiotherapist. Thank you for listening with me today. Again, happy to see you again in the same room.
In the same room.
Timmy Beams, colleague, friend, and we had some emails coming in of people talking and talking about time constraints. Never enough time. So that's what we're gonna talk about today. If I'm correct, we've also have a few sessions with the clinical confidence series. They're about time constraints. Tim, you had some great conversations with some excellent clinicians.
That's it. Yeah, it's a question I've asked a few times. Is what do you do when you're struggling for time or you don't feel like you've got enough time? So yeah, it's. I think it's a really important topic to discuss.
It is, eh? Yeah. So I do, from my own clinical experience, I can relate to that very strongly. I'm not the type of therapist that is always in time or on time. So my patients sometimes have to wait when we do have like a tight schedule, and you might have the same experience if you're listening to this. So so we're here in York, in a very fancy room. So if you're watching us instead of just listening, you will find we've got this very fancy background. So just have a look. You definitely. So this session will be also published on YouTube, and therefore you can have a good look in the room. So lots of funky art going on here. So Tim, let's start this time constraints. Whose problem is it actually?
Oh, that's a good start. Yeah, I like that. I suppose you only see it as a problem, like that's your perspective, isn't it? So that could be either the treating clinician or it could be the patient that comes in that feels like there wasn't enough time. I sort of have a flip in perspective because I just think there's always enough time to do something badly. So, like, you don't need any time at all to completely mess up, do you?
Totally.
So, and that could be just you know, forgetting someone's name or coming across like you're not listening or hearing them. So there's just immediately some things that you can do awfully, and that will set you up for a failure. So that's my flip on that. But I actually found I worked in both the National Health Service and in a private practice, and I found that seeing a lot of people in a day, and there were days when I might see, say, 30 different people, that was not helpful for me in the time that I had available. Because it takes so much energy to process and to be with and to stay curious about those people that you're with, and therefore the perspective that I had of time was I needed to change the way I worked in order for me to feel as though I could be present, I could be true to myself, I could offer everything I wanted. And I deliberately moved away and set myself up to work in a different way and to give myself more time. But there are obviously positives. There are some good things that come from that, but that's not possible for everybody. So there are constraints in the systems that we work within for many or most people that mean that isn't even a possibility.
No, exactly. So what? So let's sort of let's do a deep dive in these different contexts. So let's say an NHS public health system where you might have 20 minutes to see a patient, and this person comes in with like a probably a big story, life story. How would you go about that? So let's say planning wise. So what setting expectations and not working your ass off and basically burn out yourself. So how have you felt you find that sweet spot in working in the NHS and to manage that type of time constraints within a complex patient group?
Yeah. So and then let's just, I guess, set the scene a bit, because there will be some professions that have a lot more time anyway, although they're seeing the same people. The way that they've set things up over the time that they've practiced is that, so things like psychology have a lot more time with the patients, but I think, yeah, so one thing that you said was about setting up expectations, and I think it's important to create boundaries. So typically how I would start time with my patients is that I would be setting the scene. I would be saying, okay, this is the time that we have available, and in this time, this is what we're aiming to achieve.
Yeah.
And that doesn't matter whether you have 5 or 7 minutes. It doesn't matter whether you have an hour or 2 hours. You are setting out your boundaries, so both of you have your expectations, and that is helpful. That really, really is helpful.
Yeah. So could you give an example of how that looks like? An example, like getting it.
I would do exactly as I've just told you. I would be saying, okay, so we've got an hour together, which is how long I give my patients. We have an hour together. In that time, I'm going to ask you about yourself. We're going to talk a little bit about you, and I want you to feel comfortable sharing some experiences, but also if I get things wrong as I'm checking in, make sure you correct me so we're on the same page, and then we'd set off from there. But I also have a point where I'm checking in. So it's a very deliberate thing for me is checking in and saying, where are we now, kind of thing. So that for me is both to do with boundarying, but it's also sort of I'm thinking about how I'm validating and building a rapport and connecting with someone as well. So and I think you can do that. You can, that unravels over time. So if you only have 20 minutes with someone, then you get to know them better the next time. If you have an hour with someone, you just get a slightly longer to develop a relationship with each other as well. So I think as I said, setting out expectations and the boundaries for me is really important, but also having expectations on yourself and what's achievable in the time that you have is important as well. Because if you have 5 or 7 minutes or 20 minutes or 45 minutes, these all afford different opportunities. So knowing what you have and the systems that you work in dictate what's going to be possible.
I also think that having, like, let's say a very tight time, for example, when you you got like 5 sessions of 20 minutes, for example, then you have to make a decision on what you're going to do and what's not, right? So being very clear. Otherwise, there is, I think, also very challenging when people may have a very high self-efficacy in managing their own life, and some people do not, right? So it also depends there, right? So getting can people really can you make a difference in a person's life in 20 minutes?
Well, you can. Definitely.
You have to be spot on.
But it's a lot of pressure on you, isn't it? I mean, imagine that. You've got 20 minutes, or, in settings that I've been in, you might have 4 sessions given to you that are made available to see patients, and you have 20 minutes per session to do that in. And someone comes in who has been experiencing multiple years of pain with massive complexity. to think that you can, what can you achieve in that time? And people want to help. Like, health professionals aren't doing it because they're not empathic. They want to help. They're compassionate beings.
Exactly.
And they put a lot of pressure on us. We put a lot of pressure on ourselves to help people. And that if your time is limited, you have to recognize what might be possible as well in that time. Can I flip this around then? Because I think that's an interesting one. And biologically, I'm thinking about, if you deliver 4 sessions over a 2-month period, what we know about things like neuroplastic changes is that might only be the very start of there being change available. What are your thoughts in terms of what perhaps a more ideal system in terms of time might look like?
Well, I think one of the constraints might be that it is a set or a fixed time. So some people will be pretty much done in 20 minutes because that's the amount of information and communication and even exposing themselves to talking about their health issue. That's enough. So it only can get worse after 20 minutes, for example. It's just enough. Other people go into that zone and you feel like if we can spend a day, it's would make a massive difference, right? And that's not the flexibility of the system is not going to help. So if you're working in a private practice and you allow yourself to be more flexible in time, that's a massive. That's probably really helpful, but it may not be efficient. Especially when you have back-to-back meetings because people have to wait. And I find it really challenging. But what I learned is it's about readiness to change, but also people are interested. So building up your sessions, like being validated by what is basically what validation is step one, and the way you do it is also making sure you got resources available that you can get people to work with. So I think the therapy perhaps really starts when they leave the room. So I think having impact is like giving that example or giving that exposure or this experience, this exercise, and how they start working from there until the next session, which would make it ideally, I would say, you can only see it having impact. People come back for the second session, even if it was only like 5 minutes. I said, that one thing you said, or that one thing we did, actually, it made me think. And it really changed because I found out this and I found out that. That's where the engagement is so super important. And so I do think it's, even if you got an hour, it may be that 1 minute that made a difference, but we may need that hour to build that rapport, validation, and to maybe even giving people an alternative perspective or way of looking at their health problem. That's what I enjoy the most. So I do feel less restricted in that sense because I know in 30 minutes that will be my average time, not for a first session, it will be an hour, but like a 30-minute, I feel quite comfortable in meeting expectations, my patient, but also my own. And I said, this is what we probably can do. And instead of putting it like you have to do this and you have to do that, it's like, what's the feeling you want to leave? What's the feeling you want to have as a therapist? I would believe that I would be satisfied with I've challenged someone. I've been able to validate, to find rapport, and for the patient, it will be that actually they should feel like it has to be sort of feeling safe, but at the same time also being challenged. And because especially in people in ongoing pain states, something needs to change. And it doesn't necessarily have to be the pain, but it could be the thinking about it. It could be the emotional components, could be the social components. That sort of, wow, actually, that I haven't thought about that. I haven't done it like that, or I haven't felt it like that. So this neuroplasticity, as you mentioned, it is about violation of expectations in many ways. You have to do something or think or feel something different. Otherwise, it's very unlikely change will occur. And so that will be my 30-minute like goal. Maybe having some, this is the way we're going to do it. And we're just going to try it. And if it's probably everything is all right, this is your experience, and finding that open space to discuss. But sometimes it takes a bit of time to get your patient there, so they understand what's happening. Because, and I remember that, to be honest, when I was, I just graduated. When things turned tough or I didn't know what to do, I get straight into passive therapeutic approaches. So let's do this manip. Oh, let's do this mobilization. Oh, let's do this exercise, because it's sort of it's a safe space, right? So if you feel like you don't know what to do, even though you have time or only little time, you're more tend to do the things that we know are not very helpful on the longer term, but sometimes they're just helping you out. And just lie down and just do a little massage on your shoulder, and that gives you some time to think. And that doesn't happen that much anymore, because I do have that overviewing plan now. And that's really interesting. That's a bit of progress I've made over the years. Yeah, for myself, getting comfortable with and knowing what you're doing, and overseeing the whole trajectory instead of going by session, because time constraints is also part. I don't know what to do. You feel 20 minutes is too short when you don't know what to do, because you have to figure out what's to be next. But if you know what you're going to be doing, even before the patient enters the room, you'll be like, all right, this is what we're going to do.
Yeah.
And you'll be fine. And you don't feel like constrained in time, whether it's 5, 10, 20 or an hour. It can, you can manage that yourself. But it also, and I think that's something with LePub we talk a lot about in the clinical confidence, that we have to be a couple steps ahead. And I think we can't treat it as like, just come in, tell your story, and then we'll see about how it goes. You have several trajectories in your back of your mind, and but having this architecture basically for the treatment, it takes a while, and you need, like, nobody tells you that at the uni, how to lay out a whole trajectory of treatment, and with all the side paths and so on. So that's the experience matters there, but also I think talking together about this is really important, because that gives you, oh wow, so now I can actually plan my therapy ahead.
Yeah. I mean, that sounds absolutely like it makes sense, but there's also some really deep levels of reasoning and problem solving as well for you, and to have that confidence to be in that space at the same time, and be mindful that that's what you're doing.
Absolutely.
Does take time. Now, I as we're talking, I'm sort of thinking of some of the challenges that people coming on my courses have told me about, and something that cropped up the other day was about people who are immobilized. So say they've had a fracture, for instance, and they're in a cast and they're unable to move. And something that is fairly common practice is that people, when they go and have the cast removed, they might have a quick session with a therapist who maybe just checks things over and gives them a sheet of paper. Here's the sheet of exercises that you must do. And I'm also thinking that there will be opportunities where that time spent really well, and maybe even seeing that and dedicating a little more time in like certain situations where there is possibility of it's enough numbers of people, unfortunately, developing persistence in that situation to minimize the risk of the persistence. Because I think a lot of our examples are coming from the view that people are coming to see us having already experienced pain over a long period of time. But what better time to be really effective with our time than immediately, like straight away, and immediately would include in the acute care situation as well. So if you have had trauma, if you have had injury, then can we do better with the time that we have available at that in that distinct moment?
Yeah, that's so true. Is it so to compare to private practice and working in a public health system? Would you consider that? So, how is your experience there? Whether you would prefer to be in a system or like a private practice, because there might be up and down sides on both ends.
I sometimes think about going back into systems, and what that would give me would be lovely to sort of share my knowledge and experience and work in teams. I do a bit of teamwork, but it's a little bit more separate. So that's, but at the heart, I think I just want to buck the trend. I want to do something different. I just feel like it would be too much of a constraint on me, having had experiences in the past when I was at a level where I was asking for change to happen, and could see that would help my staff. I could see that would help my patients, and yet that was still not, a possibility. And I can see that how that challenged people at a managerial level, the budget holders, because you're asking to completely change a way of seeing how rehabilitation is presented.
Absolutely.
Instead of it being a numbers game, you're being a solution-focused, value-driven, person-centered approach service. That, unfortunately, that doesn't fit many places yet. And until it does, and until we had the money to be able to see more long-term, I don't think that I could work in a system that constrains me too much.
Yeah. So for me, it would be like, I would be a bit in the middle. Although I'm also working in a system, so we do have some more flexibility, I guess, than it would be in a public health system, hospital setting. Although I see the benefit, because it also makes the benefit of being in a sort of a system. It's clear for everyone. This is what it's quite equal. You might not. So you have the flexibility to what you decide what happens in the room.
Yeah.
So there's not so much of you have to do this or you have to do that in this session. So, and even if you got a protocol, like you need to get that sheet over, but you can check. It's your choice to use that time. You can do it in a minute and just send it, emailing it, and just go for it, whatever. But you can go through the exercise and observe what's happening with your patient. What do you feel about these exercises, rather than just do them? Have you done them? You should have done them. And there is where you can actually have this amazing opportunity to tune in, where persistent pain is likely or more likely to occur or start, because every chronic pain state has started with an acute or subacute state. So I think being in that position also allows you to observe and do the protocolized way. But also, I think protocols, it's a bit like driving a car. You're not thinking about changing gears anymore and using the steering wheel. It's like you're focusing on safety and driving comfortably rather than doing all the details. It could be a protocol helps you to maximize and maybe make your work as efficient as possible, especially in MSK rehab, like post-surgery. Some things just need to be done, right? You need to get people like at a 90 degrees flexion, or you have to go through, as a psychologist, you have to go through like an interview about childhood and so on. That could be quite straightforward, but it also allows you to sort of paying attention to the details. So I think protocols also helping young therapists just to sort of being comfortable with the basics, and then finding some place and some time to start observing and not just sharing the sheet.
Yeah.
And that's it.
Yeah. I mean, that's a really interesting way of looking at the value of protocols. Yeah, I mean, creating safety, absolutely, I'd be down with. As soon as I hear the word protocol, I'm thinking, how can I challenge the protocol? Yeah. I don't know, I'm feeling a rebel. Maybe it's the room that we're in. And I feel a bit of a rebel at the moment. But I think for instance, I teach graded motor imagery, don't I? And people often come along to the graded motor imagery courses where there is a knowledge of the protocol of graded motor imagery. Yet when you apply it to the individual, you have to individualize that, and that means that you have to be able to vary and adapt the protocol to suit that person at that time. And that's where the skill is. The skill isn't in following a protocol.
Exactly, that's just a tool.
Anybody could do that. So the ability to be able to, as you were saying, like read that person in that moment and listen to them and apply it appropriately that's a skill, and that takes time to develop. It doesn't mean you have to have been practicing for 20 years. You have to have just been able to reflect on the patients that come in and out of your practice, and perhaps have some help, have some mentorship as well with people to say.
And another just pops in my mind. So being protocolized is also a way of managing your time constraints, right? But if we overdo that, you likely will miss things, and maybe badly. Therefore, the people or the person doesn't feel validated, or it's not. You're not spot on. And I guess that when I felt like when I'm teaching the same, more in the biopsychosocial environment, physiotherapy, but also in MSK and rehab, I know that therapists tend to not asking that question, because that will feel like my time is running out. So don't ask about emotions, because the person will start you're not getting in time, right? So that will be a time constraint. So not asking the question because you're afraid this turns out to be a time issue. And I felt like you have to manage that, but never ask that questions 5 minutes before finishing your therapy, or even 10 minutes. Just start with it. So how do you feel? Instead of doing all the protocolized stuff, because you can speed up, right? So you can do a checkup on a knee and elbow, or shoulder. Can be quite efficient. You don't need a lot of time for that, but you might need a lot of time to hear what people's experiences are and really trying to connect. So my view and my experience is bring that hard question that you thought, I shouldn't ask this because I run out of time. Bring it to the next session and then start with it, rather than doing the protocol stuff first, the ticking the boxes, because you can do that. And I think, to be honest, when we do protocols and in terms of efficiency, it doesn't need to be. It's probably the least time you spend on. Sometimes you just have to, right? It's the systems requires you to tick those boxes. But even without ticking them officially, you actually see it. You observe people. You know what's going on. If they feel more, if you need to do a strengthening test, or you can actually hear in the story that they are activating, and it's actually you're on a pretty good process going. So yeah, it's
I like coming back as you're saying, like if you, let's say that the protocol dictates you do this specific treatment or this specific exercise, you always have time to do that badly. Or this particular assessment technique, you always have time to do it really badly. But if you see the value in doing it, do it well. Spend the time. Instead of thinking that you need to give someone 3 exercises, give them 1 exercise, but make sure that they totally understand why it is that you're going to ask, that you're asking them to do the exercise, and that they feel confident to do it themselves as well when
Absolutely.
they walk out. So, you know, that I think do it well. And I'm always thinking that with a physical examination that like if do it well or don't bother. If you're not going to do it well, what's the point in even trying? You know, to make sure you've rationalised something in and then do it really. And I feel really privileged that I just work with some good people. That you know, that was just front and centre. That you did everything to the best of your ability, but you're not trying to cram as much in as possible. You're being efficient with your time as well.
Yeah. Absolutely. I think that's the next. That must be a next episode about touching and using testing in people and how that, and do it well or don't. Exactly. Don't do it at all. All right, that will be a good headline for that. So thank you for listening. Thank you, Timmy, again. It was lovely.
Good to be here with you.
Yeah, thanks. Having fun. Wish you all could have been here. So once this episode has been launched, we appreciate your input. So is there anything you want us to discuss on this podcast? Please send us an email. It's not long ago, we got info@lepupscientifique.com, or otherwise just go to the website, Le Pup Scientifique. We did some changes on the website, by the way. It's looking pretty smart. Also really pushing, and we were growing. So we're really excited to see many people joining Le Pup, and that really encouraged us to keep going. And we feel like really making a difference and getting everyone more comfortable and confident in treating pain. And there's not lots of work to do. There's a lot of work to do.
Constant work to do.
Yeah. And it's exciting times. So pleased to be part of that. All right. For now, thank you for listening. Don't forget to like, subscribe, tick the boxes, follow, making sure you will get automatically notified by a new episode, as they will be published bi-weekly or every other week. So thank you for hanging in. Thank you, Tim. See you next time.
See you next time.